For literally thousands of years, healing a wound has been pretty much the same. You've got ointments, bandages, and a doctor's best guess. But what if the next big breakthrough isn't a new drug, but a totally new way of seeing? That's what we're digging into today, how AI is giving us something like superhuman vision to tackle one of the oldest problems in medicine.
All right, first things first, let's talk about the sheer scale of this problem. We're looking at over $30 billion. And that's not a global number. That's just the annual cost of wound care in the United States. It's a truly mind-boggling figure, and it represents a huge, huge burden on the healthcare system.
And here's the crazy part. Despite all our incredible medical tech, the main tool we use to assess these wounds, it's the naked eye. Seriously? For centuries, it's just been a doctor looking at a wound and using their own experience to make a call. It's totally subjective, It can be really inconsistent, which kind of begs the question.
Could a computer actually do it better? Could an algorithm that's looked at millions of pictures spot things a human just can't see? Can we bring some hard data and precision into this very, very human process? Well, that's exactly what we're going to find out.
So, to really get why AI is such a game changer here, we need to dig a little deeper into the problem. Let's talk about the real cost of doing things the old way. And trust me, it's not just about the money.
Okay, so think of the old way as kind of an art form. It's all subjective. You could have two highly experienced doctors look at the exact same wound and come up with two different game plans. And that inconsistency, that can mean serious delays in getting the right treatment. The new way with AI, well, that's more like a science. It's objective. It's based on cold, hard data, and it's standardized, which means every patient gets the same high level of analysis.
And believe me, this isn't some small academic problem. Just look at this quote. We're talking about top-tier burn specialists, right? Even they are only accurate about 64 to 76% of the time when judging the depth of a burn. The stakes are just insanely high. If you get that wrong, you could be talking about kidney failure, giving the wrong amount of fluids, or even performing surgery that wasn't needed. It's a huge deal.
So this is where the story really takes a turn. We've hit the limits of what the human eye can do, so researchers started looking for a totally new kind of tool. And that's when we enter the age of the AI doctor.
The magic behind all of this is a technology called computer vision. And let's be clear, this isn't just about a computer seeing a picture. It's about giving it superhuman eyes. These systems can pick up on tiny, subtle patterns in color, texture, even temperature, stuff that is literally invisible to you and me. And they do it in a flash.
So you might be wondering, how does this actually work? It's actually a pretty straightforward three-step deal. Step 1, you feed it the data. We're talking images of the wound for sure, but also other patient records. Step 2, the AI does its thing. It crunches all that data, looking for patterns and features we might miss. And then step 3, it spits out the good stuff, a super precise assessment, a prediction for how things will heal, or even a recommendation for what to do next.
Okay, so that all sounds great in theory, right? But what about the real world? How does this superhuman vision actually stack up when the pressure's on?
Well, the results are pretty stunning. For burns, one AI model, a CNN for the tech folks, hit 93.4% accuracy on depth and area. Now remember that 64 to 76% range for human experts? Yeah, this is a whole different league. Then you've got diabetic foot ulcers, where another model was practically perfect at spotting them. And get this, in a direct head-to-head showdown, one AI was straight up more accurate than experienced surgeons. It's wild.
Let's zoom in on one absolutely critical example. This number right here, 97%. That's the accuracy an AI hit for detecting ischemia, that's a dangerous lack of blood flow, in diabetic foot ulcers. And here's why that's so important. This isn't just about finding a sore. This is about spotting the exact condition that often leads directly to amputation. An accuracy of 97%? That is absolutely life-changing stuff.
Okay, so assessing a wound is one thing. But what if AI could do more than just see what's happening right now? What if it could actually predict the future and maybe even become part of the treatment?
This is where it starts to feel like we're stepping into science fiction. We're talking about something called smart dressings. And no, these are not your average bandages. Think of them more like tiny AI-powered healing platforms you wear right on your skin.
So what can these things do? Well, for starters, they can check the pH of a wound in real time to see if an infection is brewing. If it senses a spike in temperature, boom, it can automatically release antibiotics right at the source.
And the whole time, it's beaming wireless updates straight to your doctor's phone or computer. It's truly on-demand, personalized medicine.
And the predictive power we're seeing is just mind-blowing. Take acute kidney injury. It's a really dangerous complication for burn patients. Now, standard methods can catch it, eventually, but one AI model was able to predict it was going to happen, on average, 61.8 hours earlier. Let that sink in. That's more than 2.5 days. That's a massive head start to step in and maybe even save someone's life.
It's not just about burns either. By looking at patient data, AI can now predict the risk of a diabetic patient needing an amputation with over 92% accuracy. Think about what that means. It means doctors can identify the highest risk people and throw everything they have at preventing it, long before amputation even enters the conversation. Okay, it's really easy to hear all this and think, wow, this is the future. And it is. But we need to pump the brakes for a second. Before we hand over the keys to the algorithms, we have to have a serious talk about the huge challenges AI still faces, especially in medicine.
So AI is an amazing tool, but it's got some serious baggage. The biggest issue by far is data bias. I mean, if you only train your AI on pictures of light skin, how well is it going to work on dark skin? Not very. Then you've got the black box problem, where the AI gives an answer, but we have no idea how it got there. And that's not even mentioning the giant ethical minefields of patient privacy and the fact that all of this stuff needs to be properly tested in the real world.
And this leads us to some really tough questions. How do we build an AI that's fair for everybody, especially when we know that the medical data we're using to train it already has biases built right in? It's a huge, tangled mess of a problem, both technically and ethically. And here's another one to chew on. If an algorithm messes up and a patient gets hurt, who's to blame? Is it the doctor who trusted the AI, the hospital, the tech company that wrote the code? Right now, nobody really knows, and that's a pretty scary thought. Which brings us to the final and maybe the biggest question of all. As AI gets smarter and smarter, what happens to the human doctor? Now, they're not going away, but their job is absolutely going to change. The future here isn't about humans versus machines. It's about figuring out how they work together. And what that new partnership will look like? Well, that's a story that we are all just starting to write.